Consistent with the President's renewed hope agenda, which puts the human capital, health and social welfare of Nigerians at the center. Today, at the Federal Executive Council, Mr. President took 3 far-reaching decisions relating to the health sector. The first is on the rising cost of pharmaceuticals, the acute crisis that we have in the pharmaceutical price, the prices of pharmaceuticals, which is going beyond the reach of many Nigerians. Life-saving commodities, devices like syringes and needles, and the exit of major companies from our market. Those decisions also include the regulation of the sector to protect the health and well-being of Nigerians. And the third decision is regarding how we deal with the crisis of human resources in the health sector. The first on the syringes, drugs, pharmaceuticals, and other devices. As you will recall, Mr. President, in his wisdom, at the end of last year, in October, approved an initiative to unlock the healthcare value chain and appointed a coordinator for that. But we know that the price of pharmaceuticals have escalated and many entities have decided to withdraw, and some of the local manufacturers in Nigeria are struggling. Mr. President's intent is that we begin to take steps to enable the local manufacturers to survive, to thrive, and to deliver the basic commodities that are key to saving their lives. And he directed that the Attorney General of the Federation work with us to come up with an executive order, which is the mechanism through which he will act, given the concern that he has that many Nigerians are suffering from the cost of pharmaceuticals, as well as other devices. That is the first important step, and that should be coming out very soon. On the second front, the funding of the healthcare regulatory bodies, given the centrality of health regulation to protect the health and well-being of Nigerians, the regulators of health professionals, Medical and Dental Council, Pharmaceutical Council, community health practitioners, laboratory science, all those regulators to ensure they are properly funded. Mr. President directed that they should continue to receive the funding that they had been receiving in the past, so that there is an exception relative to other professional associations that are not healthcare regulatory bodies. We know that absent strong regulation, quackery will go up. It may exacerbate the fleeing of health workers abroad, as well as many other untoward effects without strong regulatory bodies. And that's one of the pillars of our strategy to improve governance of the sector, and regulation is part of it. And Mr. President took a decision to direct that they should be properly funded. And the third is regarding the acute human resource shortage that we have. We know, and having gone around many of our hospitals, particularly federal tertiary hospitals, the replacement of health workers that leave oftentimes takes a very long time, because waiver process takes several stages. And Mr. President directed in council that the approval of those waivers be delegated to the Federal Ministry of Health and Social Welfare, so that it doesn't have to go through the Office of the Health of Civil Service of the Federation. That will hasten the replacement, the recruitment of health workers in terms of when those leave, and also those who are out there unemployed within limits of their fiscal resources. All in all, to say that the President is very keen that we drive forward to safeguard the health of Nigerians, to earn the confidence, the trust of Nigerians, and to deliver for Nigerians in this new year that we have started. And the marching orders are very clear. And my colleague here, the Minister of State, can add more, but I think we know that we are on a path to execute and to earn the trust of Nigerians, consistent with the President's vision and his renewed hope agenda.
We clearly elucidated the 3 major steps taken in Council today to protect the health care of Nigerians. Mr. President is very keen on doing this. He's made this a huge part of his agenda to Nigeria, healthcare being on the front burner. I won't repeat what the coordinating minister said about the 3 major things. The other part I'm going to add to it is that there's a committee, a standing Federal Executive Committee that's been set up before that included Coordinating Minister for Minister for Finance, the Honorable Minister for Trade and Investment, Minister for Budget as well, that have been mandated to look at tariffs, levies, on how to protect our manufacturing sector. Today, healthcare sector, the Health, as Minister of Health, has been added to that committee. So we will work along a lot of the things the coordinating minister said, and what the president wanted was we need immediate solution to get to Nigerians. We have things that we need to do now so that Nigerians can begin to get succor from high prices of drugs and medical consumables. Those we're moving so quickly on. There's also the medium-term solution and long-term solution to protecting a manufacturing base. The committee will be working out rules or laws or legislation that will be made into the future. More specifically on the health sector, the president wants immediate succor to Nigerians with regards to this high cost of pharmaceuticals and lack of essential drugs in the pharmacy. That's of paramount importance to the president. He wants this resolved immediately. So what the president has mandated us to do is mandated the health ministry to work with Attorney General to come up with executive orders that will tackle this. So some of these levies will be removed very, very quickly. We've met with Attorney General. We're going to be having a meeting in the next several days. So that, beyond that, as I said earlier, latching on to what Dr. Pate said earlier, the short-term approach, the medium, and the long-term. So the short-term approach, those levies will be removed on essential medications very quickly, while we continue to look for medium-term, work on medium-term and long-term to protect our healthcare sector, to protect the healthcare of Nigerians. Now I'll let the Honorable Minister of Trade now talk more about what the council decided to do on the other things about levies and taxes.